Assalamu alaikum, the communication day. First scenario, 65 years old male patient, referred by GP with 6 months history of cough, short of breath, and tiredness. Investigation shows mesothelioma with metastasis to the liver and spleen. The medical team decided for palliative treatment. Discuss with him the diagnosis and management plan. Patient name, Adam Smith. Okay. Ready, Dr. Sarah?
Yes.
Yeah.
Okay. Hello.
Hello.
I'm Dr. Abdel Karim. I'm one of the doctor covering the service today. May I confirm that you are Mr. Adam, 65 years old?
Yes.
Mr. Adam, we are here to talk regarding your health condition. Is that okay with you?
Yes, doctor.
Before I proceed further in our discussion today, do you want anyone else to attend this meeting to supporting you?
No.
Okay. Could you tell me, just to be in the same page, how much you know regarding your health condition?
Doctor, I am sick maybe from 6 months. I have weakness and I have cough, severe cough, and I lose my weight. I don't know. I came for the doctor and he do some investigation for me. I came today to know what my result.
Mm-hmm. I'm sorry for that. I'm sorry for suffering, Mr. Adam, and thank you for sharing this information with me. Mr. Adam, actually, yes, we did for you some investigations, and now the result with me, Mr. Adam.
Yes, doctor. What I have,
Um,
doctor?
I'm
Yes.
sorry to tell you that what I'm going to say, it might be upsetting for you. I'm sorry for that, Mr. Adam.
What
It
you mean,
appears that
doctor?
you have a condition called mesothelioma.
It's cancer.
Yes, Mr. Adam, is it cancer that affect the covering layer of the lung? Do you have
No,
any idea
I
about it
think
before?
no. I think you are do mistake, doctor. Doctor, this is not my result. Sure? Are you sure this is my result?
I'm sorry for that, Mr. Adam. Actually, I'm quite sure, and I'm telling you now this result after I double check your names and your result. I'm sorry for that, Mr. Adam.
Oh my
I
God. Oh
know,
my God.
I know this news is hard for you and shockable for you. But be sure that, Mr. Adam, we are here. We are here because of you, and we are here to support you and to help you as much as we can.
Oh my God. There is a
So,
treatment. I'm right, doctor. There is a
yeah,
treatment. Okay.
yes, actually, okay, so I will explain to you more regarding your conditions now. Yes, the mesothelioma is the cancer that affect the covering layers of your lungs, resulting in symptoms that you are having now. And in your yes, and this likely it happened when someone exposed to long-standing to asbestos exposure. May I know if you what is your job exactly, Mr.
Yes,
Adam?
doctor. Yes, doctor.
May I know what is your job? What you
I
are
work,
doing for living?
I am retired now, but before I work in the ship worker, doctor.
Mm-hmm. I'm sorry for that, Mr.
It's
Adam. That is
related
why
to
your
my job.
condition.
It's
Yes,
related to my job.
yes, Mr. Adams, related to your job because you have been exposed to asbestos for a long time. And I'm sorry to tell you that, Mr. Adam, now your condition is like be advanced and even it spreads out and affect your liver and your the bone in your back. I'm sorry for this information today.
But you will treat me. You will give me medication. I'm right?
Mr. Adam, I highly appreciate your worries, but Mr. Adam, actually, our team, after assess you, they decided that you have your condition now not suitable, and you are not fit for any kind of treatment like chemotherapy or radiotherapy. I'm sorry for that. That is why I decided to put you in management care, which you call palliative care.
No, no, doctor. You will let me die?
Mr. Adam, your concern is valid. Not like this, Mr. Adam. We will try to help you, and we will try to support you, and we will try to keep your life, to improve the quality of the remaining life, and to keep you comfortable as much as we can. So that is why we need to keep you with this care, which you call palliative care. Have you ever heard about it?
No, doctor. Explain for me.
Okay, so the palliative care, Mr. Adam, it is like holistic care in which involve like social worker and spiritual, okay, team and pain management team. And this, the aim of this, it to improve the quality of your life and to keep you comfortable as much as you can. And this care, it is like supportive care that it, to treat the symptom rather than treat the disease itself. Are you following me?
Yes, doctor. Yes.
Until this point, are you understand me?
Yes, doctor. I understand.
So also we need to involve, yes, the Macmillan nurse in your conditions.
Okay.
So
What the type of medication they will give me, this team?
yes, regarding this team, we will monitor your condition. We will provide you, if you have any pain at any time, we'll provide you with the thumb painkiller. And if you have breathing problem, we can provide you some oxygen. And also, if you have infection at any time, we will provide you suitable treatment just to keep you free and comfortable and to improve the quality of your life. Is that okay with you, Mr. Adam?
Okay, doctor. Okay.
So do you have any concern for me?
No, doctor.
Okay, so Mr. Adam, because as we know that your conditions is related to your job before, that is why you have a right to claim for compensation if you are
What?
agree to do it. What do you
Okay.
think regarding this?
It's okay with me. Yes.
Okay, so we will involve you with the special teams. Okay, they will help you, and this is the contact number, and this the website, which is a form we need from you to fill it and to sign it. And after that, they will assess your conditions, and they will decide is how they can deserve you regarding this.
2 minutes
And we
left.
will compensate you. Is that okay, Mr. Adam?
Okay, doctor.
So,
Doctor,
Mr.
you will give me analgesia,
Yes,
painkiller. Sorry. You will give me painkiller.
Mr. Adam, I highly appreciate your concern. Yes, actually, one of the rule of this palliative care, we will involve the pain management team, Mr. Adam. And if you have been suffer from any pain, at any time, we'll provide you suitable painkiller to keep you free from this pain. Is that okay?
Okay. Okay,
So,
doctor.
Mr. Adam, with whom you are living?
I am with my wife.
Okay. So, who is supporting you at home?
My wife.
Okay. So, does you are need any kind of help, like social or any help like financial?
No, no, no. Thank you, doctor.
Okay. So, Mr. Adam, may I ask you if regarding like in such cases, advanced cases, you think regarding the future management plan, Mr. Adam? Like, did you
Well,
express any wishes regarding the next future plan?
you mean I will die nearly, doctor?
I'm sorry for that, Mr. Adam, but as in your condition now is deteriorated and in advanced, I'm sorry to tell you that it might short your life. That is why I advise you to think regarding the future plan.
How much time is still for me, doctor?
Mr. Adam, your concern is valid regarding this. We are not going, to determine for you for how long, but we will your conditions because it advanced. It may shorten your life. It might be like months rather than years. I'm sorry for that, Mr. Adam.
Okay, doctor. I don't have anyone.
Okay, so did you nominate anyone to take a decision instead of behave?
No, no, doctor, because I think I have only maybe TB when I have chronic cough. I don't think this is serious and I will die nearly.
I'm sorry for that, Mr. Adam. So I think this is the time to think regarding this and to start to do it, Mr. Adam.
I will think. Okay, thank you, doctor.
Okay.
So, so I will provide you, Mr. Adam, with brochure stressed website to read more regarding your conditions. And I'm sorry again for this shockable news today. And this is the contact number, Mr. Adam. If you have any worries or queries at any time, don't hesitate to ask us.
Okay.
Okay. Thank
Yeah,
you,
well
Thank
done.
you.
doctor.
Yeah, thank you, Dr. Sarah. Well done. Let's hear Dr. Al-Huda comment, then I will comment.
She did well. She covered all the. She tolerated the patient and she gave him the breaking bad news. She talked about the palliative treatment. It's treatment of the symptom, not the disease itself. She talked about the multidisciplinary team, and did well. And she also covered the compensation for the patient because it's occupational disease. Okay, but I don't know, Dr. Bassem. We must raise the concern of the wishes and last power of attorney because the patient is still not in the. I don't know.
Yes, I agree to do it in this way. Dr. Sarah did it in good way. How? She told about the future. So please, you can think about your future plan about how to be managed in this way. Of course, he doesn't have any plan before, but in the future, please think about your possible plan. If you suspect, or if you want, or if you wish something to be done for you, or to be offered for you, let us know. Why, doctor? Do you think I will die soon? Unfortunately, sadly, most of the cancer shorten the patient life. And in your condition, we don't know for how long you might survive. However, we will be with you in this journey. In this way. So you are not asking about previous one. You are talking about the future one. Okay. And you can offer the also if you want someone to take decision on behalf of you. No one can expect or predict that he will die because of a cancer or he had a cancer right now. So the best way is to address it as a future plan. And at the end, it's not something to be asked earlier. The most important here in this task to explain breaking bad news, but I don't know. I think Dr. Sarah, you didn't give the warning shot and the golden silence. You have to train how to do it. Okay, I'm so sorry. I don't have good news for you today. Then keep quiet. He will think and he will react. What do you mean, doctor? Is it something serious ongoing? Will I have a cancer? Please tell me, doctor. Now the time to talk. Yes, I'm so sorry to tell you that news. I know it's very difficult to hear this. I Yes, you have a cancer. Then again, be quiet. Let him react. Whatever he will do, he should react with you. Oh my God, this is bad news, doctor, for me. Let him react whatever he want to say. Then you can answer him later. Do you need any support? Do you want tissue or cup of water? Sometimes you put these things. Then you can continue your discussion. Okay, don't give the news frequently after each other. You got it. So give some space to react in between. This is the comment regarding the Breaking Bad news way. The next thing, the spreading of cancer, you have to mention it. And at the same time, you have a cancer, which is called mesothelioma, and it's a cancer in the layers of the lung, covering the lungs. Unfortunately, this cancer is spreading away also from the lung to the spine. I read it spleen, by the way, earlier, but it's spine, yes, to the spine and the liver. And again, the patient will react. Whatever he will do, just try to address. Maybe he will say, as the Dr. Rhoda said, are you sure, doctor, this is my news or this is my result? Please confirm. And yes, we are here. We are discussing such kind of result after confirming the information for you. Such kind of result will not be delivered unless it's double checked by the patient file and patient name and file number. Okay. This is a way how to confirm and to address this point. The other point, he asked you, doctor, will I have any medication? You mentioned the chemo and the radio. What do you mean by chemo and radio, Dr. Sarah?
Yes, chemotherapy,
Yeah,
medication
but
that kills the cancer cell.
does he know? Does he know
Uh,
the chemo? I mean, you have to
because
explain. Yeah.
yes.
Okay.
Mhm,
Or even you can say, I think no cure, nothing can be offered.
mhm.
Okay, in this way.
Because
So
he asked me regarding the medication.
yeah, okay. If you want to
Yeah.
explain, yeah, there is what's we called chemotherapy, which is medication can kill the cancer cell, but in your condition it will not help. As
Yes.
well as for the radiotherapy, which is some radiation can be offered to you to kill again the cancer cell, but in your condition it won't help. So
Mm.
in your condition, the only treatment or management can be offered what we call palliative therapy. And now the time to explain. Have you ever heard about the palliative therapy? Can you, doctor, explain for me? Yes, palliative therapy means a group of doctors and team of specialists. They will be beside you in this journey. They will offer you the whole medication and treatment that can help to support you and to give you free of all what you will suffer from, like pain or infection or depression, low mood. So they will be sure that you are free of these symptoms. This is the aim of our palliative team. One of them, Macmillan nurse, but in this scenario, no Macmillan nurse because he will not have any chemotherapy. Macmillan nurse for the chemotherapy. Okay, so a specialized nurse you can mention, the mood doctor, to be sure that you are not suffering from all these symptoms. So what we are doing, we are just treating your symptoms. However, the cancer will not be cured. We just help you to live near normal life and to be sure that the quality of your life is still maintained in this way. Okay. If you ask more about, for example, doctor depression, you can ask offer. I will offer for mood doctor. Anything he will ask to be free from, you can offer him a team. For example, the pain, as you did exactly. So we'll involve one of the team, the pain management doctor. One of the doctor, he should be beside and he will be along with you in this journey. He will be sure that you are not suffering from any pain. Yeah, you have to raise the issue of legal advisor for the compensation, but you will not fill the form by yourself. There is a form, there is a process, but this is not your job. So I will refer you to the team responsible for this, which is called legal advisor. They will give you a form to fill it, and you will proceed with them. You will follow up with them. Okay? This is the job or the task of the legal advisor, not yours. But you have to raise it. Can I know what's your job? I'm retired, doctor. Oh, okay. Can I know what's your previous job? Yes, I was working as shipyard, whatever. Now the time to offer him the compensation. The support with whom you're living. Anyone at home need or dependent on you? Does he need or does she need any support? Or do they need any support? No, doctor, we are fine. Okay. At the end, you can ask him if you have time. Do you think this is the time to think about your future? Do you prefer any kind of management you should treat with? No, doctor, I didn't expect, I didn't think about it. Okay, you can think about it in the future. Any preferred way to be managed through? Please let us know. Or if you want to nominate someone to take a decision on behalf of you. But it will not be as a previous. Okay, don't ask about do you have any living wish? Because no one expect or he's not expecting that. Okay? It's a good idea to manage it or to deal with it as a future plan, not as a past issue. Clear, Dr. Al-Huda?
Yes. Yes.
Okay, any question, Dr. Al-Huda or Dr. Sarah?
No.
Anyone has question before
No,
moving?
doctor. Thank you.
Okay. Any suggestion from others? Any suggestion from Dr. Al-Huda, Dr. Sarah for this scenario? I think palliative therapy one of the preferred scenarios in the PACEs now. Because you will just be sympathetic, empathetic, breaking bad news, delivering the news in a good way. I hope, Dr. Sarah, you should be more sympathetic and empathetic, okay? Try to make your tone lower little bit while saying the news. You are trying, but still you have to do more.
Okay.
Okay. Yes, no need for Macmillan nurse because no chemotherapy. And the Macmillan nurse is one of the chemotherapy nurses you should offer whenever the patient having cancer, he will receive chemotherapy for it. In this scenario, no chemotherapy, just palliative. So the way to manage is symptomatic supportive one. Okay. Anyone has a question or comment? Dr. Ala, I hope you are.
Yes, Dr.
Yes.
Bassem.
Yeah.
Actually, Dr. Sarah covered everything in an impressive way, and that's good. Also, she covered the compensation and the advanced care plan. In the beginning, she told that I have something upsetting to you. I think it's not a good sentence to say to the patient because upsetting means it will make you angry. So it's better to say like I don't have good news for you.
Yeah.
Or yeah. And also the golden silence. She didn't give the golden silence.
Yes, exactly.
Yeah, and as you mentioned, also she said some jargons like chemotherapy and radiotherapy, and also the asbestos. She told because of exposure to asbestos, I think she needs also to explain the asbestos.
I agree. Yes.
Yeah, the material. Regarding the Macmillan nurse, I think also it's included in the palliative care, the Macmillan nurse, because I think this nurse, it's her work, it's like orientation. It's not treatment. It's like to orient the patient about the diagnosis, the treatment, the possible side effects, and also supportive and guiding for the patient, not only for the chemotherapy.
Okay, let's clarify it. We can search
Yeah.
about it. But what I know, she's assigned for the chemotherapy. Anyway, if you are in doubt, just mention a specialized nurse. So a specialized nurse would
Yes,
be
yeah.
involved in the team. But
Yes,
for the chemotherapy, yes, it should be as a Macmillan nurse. As palliative, I don't think it is a Macmillan nurse. Anyway, anyone has evidence can share it to the chat box.
What's
Yeah.
the non-jargon for asbestos?
You can say chemical exposure to chemical in your shipyard or in your olfactory. Okay.
Harmful substances with long time exposure.
Sorry.
Harmful substances exposure for long time.
Yes, yeah, it's a chemical or substance that you are exposed through inside this olfactory or I don't know. I think yes, shipyard olfactory. So it's exposed for a long time, and with a long time, most of the patient. By the way, you don't have guarantee. This is the reason. So you can tell him it might be because of exposure. Don't say this is the reason of it. Okay, he might be
There's another
smoker.
reason for mesothelioma apart from this?
Smoking, if you remember, smoking plus asbestos
No,
make the.
smoking not related to mesothelioma.
I
Not
remember
the case.
smoking, and asbestos make the
Smoking
mesothelioma
can
50
predispose
times.
to any cancer. Smoking predispose
No.
to any cancer, including the mesothelioma.
Yes, there is times, I think it was 50 times with asbestos and 10 times with a
This is for
smoker.
lung cancer, yes. But
Lung only.
mesothelioma is just occupational, yeah.
Anyway, if you want
No,
to
not
mention
just
it,
occupational. It can be related to smoking
smoke.
also.
Yes, I think so. I think so, Dr. Aisha.
But we should mention here the compensation as the patient already working in ship. I think it is the risk.
Mostly
Yeah.
related to your previous job.
Mostly, yeah. Don't say or don't swear this is because of it. Mostly because of it. Okay, this is my opinion or my advice. Don't say because you just narrow the cause or the reason to the direct cause to the asbestos. Yes, he will be and it will be under investigation and process if he need or if he desire or no or deserve, sorry, or no. If he deserve it, they will compensate. Why I'm saying that they might raise the issue of compensation, and later on they might say no, he's not candidate for compensation, and he will blame you. Why, doctor, you told me this is because of that, and they didn't compensate me. So you can say mostly because of it, and we will do the process. You might be liable for the compensation. Okay. Don't
Okay.
be 100% sure about anything in basis, and mainly in the communication scenarios. Okay. Okay.
Okay.
Well done anyway. Thank you,
Thank you.
Dr.
Thank you, Dr.
Yeah,
Bassem.
Dr. Nada wrote also
Dr.
Macmillan nurse, deal with cancer patient, specialized
Dr.
nurse with other
Bassem,
disease. Yes, go ahead. Dr.
hello, how are you?
Yeah,
Dr. Bassem, regarding the smoking, some examiner question, or not examiner question, some like concern from the patient when you will ask him if you are smoking, then he said, doctor, if the smoking the cause of my disease, we will say no, because it's regarding your this material or chemical material, but also he will ask again, if I stop the smoking, it will improve my outcome.
Good question.
So yeah,
No.
so here also the answer, it will not affect the outcome of the disease, but smoking harm you anyway, so you must stop smoking. But
Yes.
it's not regarding to the direct يعني to the mesothelioma.
Exactly.
Like Dr. Sarah,
Yes.
we know
exactly.
this, yeah, this in, yeah.
Okay.
Even
So
get
it's
the
If as
feedback. Yes.
yeah, if it is as a concern, you can answer it, but don't ask it because he's terminal patient. Okay.
I don't know. Yeah, maybe yeah. The question come from the patient. Yes. So in the
Exactly.
palliative, we will not ask about smoking and
Yes, no need.
yeah, yeah.
Even there is
Thank you.
direct effect, but now the patient almost having the cancer is spreading everywhere.
But here I feel it's most yani even because it's palliative, so it's not end of life care. So
Yes,
we
agree,
cannot,
agree.
yes, we cannot tell him not to stop smoking, right?
You cannot ask it. No
But
need to ask it.
if it's come
If
like
he
this,
ask you, yeah, if
yes.
he raise it to
If
you,
I stop my smoking, it will
oh,
affect the outcome.
okay. So
No,
you
it will
can tell
not
him, yes,
affect,
it
but we
might
advise
help
you.
you. It help you not for the cancer. Okay, because always the smoking will have effect on the airways and for example, COPD patient.
Yeah.
But as a cancer wise, it will not affect or change the outcome of the cancer.
Yes, like
Yes,
this.
That's why we didn't raise it as an issue in the scenario. Any patient for palliative with spreading cancer,
We
advanced
will not
cancer,
talk about
we
it.
will not talk about exactly why. Because let him enjoy the last days of his life. Even he will live for months, but still, he's advanced cancer. He might die after months or maybe weeks. You don't know exactly. So, according to the experience before and the feedbacks, the examiners doesn't like to talk about smoking or the alcohol. Let them
Yes.
enjoy the last moments. Okay, good discussion, by the way. So the smoking not to be raised, but if raised, you can talk about it. The compensation, yes, regarding asbestos, but don't be 100% sure that it is related to the asbestos. But you have to raise it and to refer him to the legal advisor. Okay, someone, Dr. Ala. Thank you, Dr. Ala, for your comment. Macmillan Nurse can help you with your cancer diagnosis, treatment, and help manage side effects. They offer information, emotional, and practical support. They can also tell you about other support available. This may include information about social care, benefit, advice, and local support group. So you can mention or you can say it's included in the palliative. But
Actually,
if you
Doctor,
yes, go ahead. Yes.
yes, Dr. Bassam, actually, I have confused about these scenarios because sometimes chemotherapy and radiotherapy could be, and even surgery could be a part of the palliative care. So, like in the scenario, they didn't tell us that if we will need chemotherapy or no, radiotherapy or no. Maybe it's a part of palliative care, not just to cure the disease. So
Exactly.
yeah, so sometimes I just think about that. We can involve a group of doctors, including the cancer doctor, the Macmillan, and also a team called the palliative care team who will intend to kiddo, kiddo, kiddo. So I just think that we need to involve the cancer doctor and the Macmillan nurse, actually, because he is
Perfect.
discovered
Okay.
now cancer, and yes, might be need even chemotherapy, radiotherapy as a palliative treatment.
Yes. Thank you.
Yes.
Valuable comment. Yes, you're right. There is possibility to be as a palliative therapy, as chemotherapy, also under term of palliative. Chemo, radio as a palliative. I agree, but the main concept, they will not cure the cancer. Okay? Even the chemo here, it will not be as a cure. The same idea of pancreatic cancer with advanced metastasis, they are trying to do some supportive and palliative surgery, which is ERCP. Is it curable? No, it's just resolve the symptom, trying to resolve the symptoms, the jaundice and the itching or the pain or the obstruction. But still, the cancer is not curable one. So you can mention it, but it's not to cure the cancer. It's just to help you to feel good symptoms or good quality of life. Okay, you got it? Why I said that? Because the main question in the scenario, the surrogate he will tell you, will I be cured from this cancer? No, it's not to be cured. It's just to help you to feel free of symptoms and to live not the normal life, near normal life. Okay? Clear for all? Or anyone has doubt about it? Okay, let's move to the next scenario if no more comment. Thank you, Dr. Ala, for your share. The second scenario. Your role, you are the senior house officer in the admission unit. Mr. Edward, 36 years old, brought to you or brought to the ER from the school today and admitted to the hospital. He was complaining of a headache, fever, dizziness, and a fall at work with the body rush. Rapid deterioration of his condition within few hours. All investigation, including lumbar puncture, confirmed diagnosis of meningococcal septicemia. His GCS is 7 with impending ICU admission. Your task is to talk to his wife, Mrs. Jacqueline. Explain to her about the husband condition. Dr. Al-Huda, you're ready to start or you want some minutes?
Yes, doctor, I can start.
Okay, here you go.
Hello, I'm Dr. Naji, one of the doctor in the service today. Are you Miss Jacqueline, relative of Mr. Edward, 36 years old?
Yes, doctor.
Nice to meet you, Mr. Jacqueline. I want to ask you, are you the next kin of Mr. Edward?
Yes, yes, doctor.
Okay, Mrs. Jacqueline, we are here today to discuss some issue about your husband health condition. It's okay with you?
Yes, okay, doctor. Okay, doctor.
Okay, Miss Jacqueline, you can tell me what you know about your husband health condition?
Actually, doctor, I didn't know anything, doctor. My husband today, he's quite well, and he go to his school for working, and now the hospital call us. I came here, doctor. Please tell me what happened for my husband exactly.
I'm sorry for that, Miss Jacqueline. I want to explain for you. Today, your husband, Mr. Edward, he feel sick and he has high temperature and he feel dizziness and fall down in the school. For that, they brought him to the hospital. I'm sorry to tell you that. And when you examine him, we find him his condition not good. I'm sorry to tell you that. He's really sick. He has high temperature and there is a skin rash in all the body. And also his conscious not well also. I'm sorry to tell you,
Doctor, you are sure this
Jacqueline.
is my husband? You are talking about my husband, doctor?
I'm sorry, Miss Jacqueline. Yes, this is your husband, Mr. Edward.
Mm-hmm. So what happened for
Uh,
him, doctor?
he feel not well in the school in the morning, and he has increase in the temperature, and he feel dizziness, and he fall down. I'm sorry, in the school. For that, they brought him to us. When we examine him, we find him he's sick. His temperature high, and there is a skin rash in his body. And we do for him some blood work, and we take sample from his back. And I'm sorry to tell you, Miss Jacqueline, the sample show he has a bug infection called meningococcal. You have any idea or you hearing about this before?
No, doctor. What is this, doctor?
I'm sorry, I will explain for you. Miss Jacqueline, this is bug infection. It's transferred by the droplets, and its cause can affect the body and can cause the symptom that's came the same symptom with the Mr. Edward. High temperature, skin rash, and can affect many organ in the body. I'm sorry. For that, I'm sorry to tell you, this is a serious infection. For that, we put your husband in bedside room because this disease, this bug infection can transmit it for another. I'm sorry, Mr. Jacqueline, can I ask you, in the last week, he contact with any sick patient or when anyone sick?
I didn't sure, doctor, because he's working in the school, doctor.
Okay. And what's about you, Miss Jacqueline? You complain from anything? You feel anything? You are feel sick or something?
No, doctor.
Okay, Mr. Jacqueline, as I told you, because this is this is this bug infection can transmit it. For that, we need to inform the health department about this. We need to notification about this bug infection. And I want you to also, we need to screening for you, and we will do screening for who's contact with Dr. Edward, and we will give you also antibiotic, Miss Jacqueline.
Doctor, please, can I visit my husband now? I want to see him, doctor.
I'm sorry, Miss Jacqueline, as I told you, it's the bug infection can transmit it. If you visit him, better you stay out the room. You can see him from the out the door, okay? Better, because I advise you, if you visit him, you visit him out of the door. You not enter to the room. And if you want to enter the room, you must wearing some gown and some gloves and also mask to protect yourself. It's important to visit him, Mr. Jacqueline, okay? But better you stay out the door, because I as told you it's transmitted. Maybe you also infected with it. Okay with you, Mr. Jacqueline?
Yeah, okay. So, doctor, can I bring my kids also? They crying at home, doctor. Can I bring him to see my husband?
I appreciate your concern, Mrs. Jacqueline, but advise better we don't bring the kids for to visit him. It's better for them, because we need to protect them, because this is really, this is serious infection. I'm sorry to tell you that, Mrs. Jacqueline. Mrs. Jacqueline, I want to inform you the condition of your husband now. It's really critical. His conscious not good. He has degrees of level of conscious. For that, we will admitted him also in the intensive care unit, in the isolated room, in the intensive care unit, and we will follow with him. You have any another concern, Miss Jacqueline?
Yes, just doctor, what you are going to do for him, and what the outcome for this condition, doctor? He will become better soon, doctor.
I appreciate your concern, Miss Jacqueline, but as we will admitted him in our hospital. We will do for him blood work and investigation, and we will start for him the medication, and we will follow with him. There is a group of the doctor, they will follow with him, okay? The outcome of this condition, Miss Jacqueline, I told you it's serious bug infection. For that, it's maybe cause permanent damage in the brain, maybe cause also hearing loss, maybe affected his cognitive. Nobody, this is some, and also I'm sorry to tell you, it can cause to death. I'm sorry to tell
2
you
minutes
that,
left.
but we will try to do the best for him, Miss Jacqueline. It's okay with you? Are you with me, Miss Jacqueline?
Yes, doctor. Just I'm very sad for this, doctor.
I'm sorry, really, I'm sorry for this bad news today. I highly appreciated your feeling, Miss Jacqueline. But as I told you, we need to screening for you and for your kids, because you contact with him, and we will need to give you and your kids also some antibiotic, and advise you, if you feel you are not well, or there is any high increase in temperature, you or your children, please come directly to the hospital. Okay, Miss Jacqueline?
Okay, doctor. Okay.
Miss Jacqueline, I want to ask you, who's depend on Mr. Edward?
Me and our kids, doctor.
I'm sorry, you need any help at the home? You need financial help?
No, doctor.
Okay, Miss Jacqueline, I will give you some paper and leaflets to read more and website to read to know about this infection and how much it's serious. It's okay with you, Miss Jacqueline?
Yes, okay, doctor. Thank you.
Any another concern, Miss Jacqueline?
No, doctor.
Okay, thank you, Miss Jacqueline.
Thank you, doctor.
You have a second, you want to offer something?
Offer. Okay.
What you want to offer here? Always remember at the end, if you have some second, offer here some leaflet, brochures, website about the condition of her husband or her. Okay?
Yes.
Okay,
Okay.
okay. Time is up. Dr. Sarah, you can comment now.
Yes, she did well. Apart from nice to meet you in the introduction, and also yes, the explanation of meningococcal septicemia. Just explain the infections, but regarding the septicemia itself, this bug infection it is spread to
Yes.
the blood, causing poisoning of the blood. Okay, and also apart from symptom, we need also to explain for complications. And I'm trying to remember you regarding the outcome of this condition to explain for me regarding the complications, like it can affect the vision, can cause weakness, it can affect the hearing. Okay.
Okay.
Yes. Apart from that, yes. Regarding ICB, regarding the isolation, yes, you did mention it, and also infection control team. You, I'm not remember if you are mentioning it or not, and also the public health notification. Okay.
Yes. But infection team,
Or
I'm not
contact tracing, yes,
informed.
yeah,
Yes,
yeah, yeah.
I
In
forget.
the isolation, yes, we need to keep your husband in the side room or in the room of its own to
Okay.
prevent this spreading of infection to the others. Also, when I'm asking you regarding I want to visit my husband now or كده, yes, you can advise me first to avoid the contact. Actually, no solution. Uh, we can visit him with gown or a mask. No, just yes, from outside it acceptable.
Okay.
Yes. Apart from that, you did fine.
Yeah, thank you,
Okay.
Dr. Sarah, for the scenario. Let's start from the last comment. Any patient, the patient has right to visit him. Even the isolation, yes, she can visit, but in the emergency or after advising her, it's not preferred to be inside. Okay, so you cannot tell her no, it's not allowed. It's not preferred to be inside in order not to have or to catch the infection from him. However, you can watch him from the glass outside, and if you are preferring to stay safe, please stay out. No, doctor, I want to be inside to visit him, to talk with him. So in this time or at this moment, you have to wear some precautions or to take some precautions in the form of gloves, mask, and what we call yellow gown in order to be safe, particularly in the first 48 hours. Okay? Why? Because this is the most infectious period and he's under isolation now, and we are giving him strong medication in order to kill this bug. And in his condition, the bug is spread even to the blood. Okay, this is regarding the visiting. The isolation already mentioned, the contact tracing. Yeah, we have to screen and to ask who had contact with him in the last week, either in the school or at home. Please be informed that anyone has symptoms, he should visit or he should seek medical advice, particularly the close contact. Even we can give them some medication. It's called prophylactic antibiotics.
Mm-hmm.
Okay. The next, yeah, I agree anyone not to say I'm here, nice to meet you in any scenario, either long or communication, because the patient is always not nice to see you. Any patient in the hospital, be sure that he's under stress. Going to the hospital, even for visiting someone, you feel stress. What about the one who's entering as patient? So never ever the patient or anyone in the hospital feeling nice. Even us as a doctors, you are not feeling nice when you go to the job or duty, right? You are always feeling distressed. So it's better not to mention it at all. I'm here to discuss. I am Dr. X, you are Mr. X, and try to correct your pronouns, Dr. Al-Huda. You always saying Mr. to Mrs., Mrs. to Mr. Okay, be sure that you are calling the correct name. So Mrs. means Mrs. Mr. or male. Okay, don't mix, because you mentioned it thrice, Mr. Jacqueline. You are the next of kin. You are the wife. Yes, you want someone to attend. She can or you can invite. Why? Because the patient is already comatose, so he lost the capacity. I don't have good news for you. Breaking bad news. Definitely, you have to use it. It's a spreading infection. I think better to say I don't have good news for you today. Why, doctor? What happened? He has a condition called meningococcal septicemia. Now the time to be quiet, as a golden silence. Okay, let her react. Oh, what is this? It seems something serious. I cannot understand. Let her say whatever she wants. Now the time to explain. So don't explain the symptoms earlier. He came to us with a rash, and no, I prefer to do it as breaking bad news, then explain everything up after that. The pathophysiology, it's a bug, super bug, start to invade his brain layers, then it's now reach to the blood. And unfortunately, this bug is very violent or very strong, that it might lead to certain complication in the form of coma, fever, or high body temperature, even skin rash, dizziness, which he presented with earlier. Okay, this is the complication. The pathophysiology we mentioned, with the organism, the manifestation, and the complication. The patient might present with deafness, weakness, coma, up to death. So the manifestation, fever, and sometimes shakiness, feeling unwell, and the complication, deafness or weakness or coma, even up to death. I'm so sorry to say that. It's bad news. I appreciate your worry and be sorry for every bad news. Now the time for the other task: infection control, public health, to screen the contact tracing at the work, which is the school. Okay, sometimes they will bring as working in a company, whatever. You have to mention the infection control, notifiable disease. We should notify this, and public health office. They will screen even to the close contact at work. If you have any symptoms, but don't ask here, do you have? Because it will consider like taking history. In case you have these symptoms, please visit the GP, or we can give you some medication. Don't ask here, do you feel or do you have? It will consider as taking history. So what I should do as advice, in case you have or your kids having fever, please bring them. We can give them medication, like
Okay.
instruction. Okay. Yeah.
Okay.
Who's dependent? Who's living with you or with him as a support? Don't offer always the financial. Do you need any kind of support? Whatever the kind of support means, even the financial, but you are not offering financial. Why? Because no role here to support them financially. No one in UK giving money. They support only by insurance or social support, trying to help the
Okay.
kids, but they are not giving money.
Okay.
Apart from that, yes, it was good performance. Okay, any question, Dr. Al Huda or Dr. Sarah?
No, thank you, doctor.
Okay, Mr.
Doctor,
Welcome.
not enough.
Yeah.
I told I will inform the health department because I forget to inform the public,
Yeah.
and
Yeah.
I
Yes.
said I will inform only the health department. That I don't know. It's enough, or I must say it.
No. Sometimes they want you to pronounce the name. After that, you can explain it. So infection control team in the hospital, they are team assigned to take care of this such kind of infection. And public health office, they can take care of the contact with your husband for the last 1 week. They will screen them or contact tracing. What's called contact
Okay.
tracing. Okay. Try to pronounce the team name. Why? Because they want to hear such things from you. But
Okay.
if you didn't, at least explain it. But better to show the examiner that I mention it. They will write it as a positive comment that you mention this team, that you already involve the infection control, the notified or the notification or notifiable disease responsibility. You did it as a task. Okay?
Okay, doctor. Okay. Thank
Yeah,
you.
don't forget the medication through your his blood channel. It's very important. Some scenarios they will ask you, please, can I take him home? I can take care of him. No, it's something it should be isolated or kept in a side room in order to give him a proper medication and to keep him away from others in order not to have another infection and not to spread this infection. Don't always predict that you are keeping the infection not to go out of the patient, even catching another infection. Why? Because some relatives they will tell you, so you are aware, you are worried about others. What about my husband? So keep it in your mind. Always mention that we are worried about him not to catch another infection because his defense system is weak, and as well as he will not get spread the infection to others. So you show here that you are taking care of him and taking care of others, not only others. You got it?
Okay.
Yes. Okay. Any question
Doctor,
else?
Dr. Bassem,
Yes.
when I want to inform the relative about the isolation and
Yeah.
treatment, uh, they say don't say anything not written in the task. For that, I fear if I mention this, uh, not good. I don't
By the
know.
way, the scenario will not be 3 lines as in our practice or meeting. Always the scenarios will be full of paragraph and the page. You can read a lot of information. The task up and the scenario in one paragraph, and down they will tell you, for example, the patient data. So the paper will look like congested with information. It's not only 3 lines. Patient have meningococcal septicemia. Please talk to her wife. No, it's full of details. And try
Okay.
to pick up and write the most important things you have to talk about.
Okay.
Okay.
Thank you, doctor. Thank you.
Okay. Most welcome. Thank you. Yeah, yes, I will read the comment. Dr. Ilaf, disease scenario 3. Okay, I agree to mention cause, pathophysiology, clinical picture, complication. Yes, so this is what I mentioned. She said sorry a lot. Yeah, don't say sorry many times. Always just do it once you are breaking the bad news, and maybe once you are supporting the wife for help. Okay, not for every word you will be sorry. Sometimes being empathetic, sharing the feeling is much important than saying sorry, which is the sympathetic. So the sympathy to say sorry for the patient, but it's not required as much as being empathetic. So you will feel sorry by your feeling, not by your word sorry. The tone, using the tone, appreciate your worry, understand how you are feeling now. These things much better than saying, "Oh, I'm so sorry again. I'm so sorry again." Okay, so sharing the feeling is much important than saying sorry. Any other comment
Okay,
or
doctor.
question? Yeah, thank you, Dr. Huda. Any comment, Dr. Sarah, or any suggest?
Yes, regarding the complications, there is a special complication here in this scenario. It can affect the gland located above the
Yeah,
kidney.
yes, you're right.
Yeah,
And joint as well.
because yes, tummy
Septic
infect.
arthritis. Yes. Particularly when they mention the septicemia
Adrenal
as well.
hemorrhage complication, yes.
Yes, you're right. But in meningococcal meningitis itself, you can talk about the brain issue. If it's spreading beyond the brain, this is the time to speak about the extra neurological manifestation like adrenalitis, insufficiency, and septic arthritis. You're right.
Waterhouse, yes.
Yes, perfect, Dr. Sarah. Thank you. Good point to add
Thank
there.
you,
Yes.
Dr. Bakri.
Thank you too. Anyone with other comment or suggestion? It's open for all of you. I will not mention by name, but the commonly comment like Dr. Ala, Dr. Aisha, Dr. Tahani. Anyone want to comment? Please feel free to comment. Dr.
Yes,
Dr.
Dr.
Kinana.
Bakri,
Basim.
regarding, I'm sorry, okay.
Okay.
Go on, Doctor.
Yes.
Yeah, I'm sorry, Dr. Hala.
No worry, Dr.
Yes,
Sama. Dr. Sarah, continue. Yes.
yes, regarding the tracing of the contact,
Yeah.
I think this is the job of occupational, infection control department.
Yes.
Not,
But you have
yeah,
to
but
mention it.
yes, that is why we mentioned.
Yeah. Yeah. We mentioned, but we'll not do it by ourselves. There is a
Yes,
team
yeah, because
responsible.
yes, she asked regarding the contact tracing.
Yeah, don't ask. That's why I told her don't ask her about the symptom. Do you have cough or
Yes,
fever? Yeah. So this is
yeah,
not our job. We
the
will.
questions.
Yes, exactly. Okay. Thank you, Dr. Sarah. Yeah, Dr. Ala now.
Yes, Dr. Basim. My comment was it was mentioned in the scenario that his GCS 7. I think it is mentioned like to also to during the consultation, during the communication, you should
Yes.
also inform, that he's in a coma. We need to admit him to the intensive care unit, and also we will involve in the MD team, the ICU team, the intensive care
Perfect.
unit team, and we need also to connect him to a breathing machine because of his low GCS.
Perfect. Yes. Good comment.
Yes. And also regarding the job, he is a teacher, so the part of what we will do notification to the public health authority,
Yes.
and they will contact the school doctor to do tracing also for the close contacts to him. If
Yes.
anyone got sick or anyone need to take also the treatment to prevent them from getting the infection.
Yes. Perfect. Exactly. Always use every word in the scenario or sentence. Patient might be in ICU, you have to mention it. I agree with Dr. Ala 100%, absolutely right. Use it or mention it while discussing. So, because of his coma, we might admit him to the critical care unit. Okay, it's one of the missed point we didn't talk about, but be sure that when they write a sentence, it will mean something. You have to say and to mention it to the patient. So coma, GCS 7, at least we mention it, one of the complication, which is coma. But you can add also one of the important thing you have to talk about is admission, possibility to be admitted to ICU. Why? Because it's written in the scenario. You are not inventing. Okay. Thank you, Dr.
Yes.
Ala, for your comment. Any other question or comment or suggestion? Anyone with comment? Any question?
No, thank you, Doctor.
Okay, so we can end the session. Thank you, Dr. Al-Huda, Dr. Sarah. Particularly, thank you everyone for the comment,
Thank
for the
you.
attendance. Thank you, everyone. We'll see you tomorrow, inshallah, with a short clinical day. Okay. Good
Okay,
luck and
thank you.
good night. Assalamu alaikum wa rahmatullahi
Thank
wa
you, Dr.
barakatuh.
Bakri. Jazakallah
Most
khair.
welcome. Wa iyyakum. Thank you.